Hello, I am Dr. Satyaprakash Mahajan, consultant dermatologist practicing at Rudranshu Skin and Eye Care Clinic, Nashik, Maharashtra. Today we will discuss about a common topic, urticaria, or commonly known as hives. Hives often appear as raised itchy rashes on the body. The medical name for hives is urticaria. People also call it welts or wheals. Hives or urticaria can occur for many reasons, such as exposure to an allergen or a physical trigger like pressure from tight clothing. It may also indicate an infection or underlying health condition. Studies have shown that urticaria affects around 20% of people at some point of time in their life. Urticaria can be classified as spontaneous or inducible. Spontaneous urticaria can further be acute or chronic. In acute urticaria, symptoms, which are the hives, usually occur for a short duration like a few days to less than 6 weeks. Whereas in chronic spontaneous urticaria, the symptoms keep lasting beyond 6 weeks, at times even persisting for a few or many years. Inducible urticaria or physical urticaria, however, is classified as a separate entity unlike spontaneous urticaria because in physical urticaria the hives occur when external physical stimuli are present. Although physical urticaria can be chronic in nature, but it has been mentioned as a separate entity due to its inducible nature. Sometimes there is no clear reason as to why hives occur, especially in chronic spontaneous urticaria. However, urticaria may develop as a reaction to an allergen, a physical trigger, or secondary to some diseases. Various allergens have been identified ranging from different type of medications, for example antibiotics, painkillers, to food allergens like nuts, seafood or fruits, to certain contactants like cosmetics or plants, which when they come in contact of the skin of a susceptible person can trigger urticaria, which is known as contact urticaria. Amongst the physical triggers, the possible ones which have been identified are sunlight exposure, scratching or rubbing of the skin, which is called as dermographism, and like previously mentioned, urticaria can also be spontaneous reaction but to hitherto unknown causes. How does one diagnose urticaria? Very often it is the history of the patient rather than the examination which gives the clues. Many a times urticaria has already subsided before the patient presents to a dermatologist. In this era of technology, fortunately, most of the patients take photos of their rashes and then show it to the dermatologist. The symptoms of hives include raised itchy bumps or wheals on the skin ranging from a size of a pinprick to several inches across. The bumps are usually red but can also be skin colored. Usually evanescent, often within 30 minutes of time, but usually they can also last up to 24 hours. At times, one may get diffuse larger swellings around the eyes or on the lips, which is then called as angioedema. Why these symptoms occur is for one to understand. When a trigger of urticaria happens, the immune system cells, as a response called as inflammation, release a substance protein called histamine in the surrounding skin, which leads to dilatation and leakages of the blood vessels, causing fluid to seep into the adjacent skin, which looks to the naked eye as redness, bumps, or even swelling, and symptomatically makes one feel very itchy. The time it takes for the lesions to appear depends upon the cause. In someone with contact urticaria, the reactions can occur within 10 to 60 minutes of exposure to the allergen and can last up to 24 hours. In persons with food allergy, The hives usually appear within 1 hour. Reactions to food colorings and other additives can appear after 12 to 24 hours. A reaction to a drug can appear at once or even much later, a month or a few months after starting the use of medication. In some cases, the hives can persist for several days too. Management of urticaria includes not just the treatment but counseling regarding the condition and added preventive measures one may need. Dermatologists, owing to their basic training in the field of skin allergy, are better equipped in managing urticaria, especially the chronic types, as these conditions have a major negative impact on the quality of life of the patient suffering, which demands measures beyond pharmacotherapy. Acute urticaria most often is managed with oral antihistamines, preferably non-sedating ones, and eliminating the underlying trigger. Usually, with proper history taking, a cause may be identified and eliminated, like an example of a food allergen which can be avoided, or in post-infective cases when the underlying infection is treated, it can tame down the urticaria. A rare fatal emergency condition known as anaphylaxis, where sudden urticaria can occur with respiratory insufficiency, needs to be treated aggressively with injectables like antihistamines, adrenaline, and steroids. Chronic urticaria. A person with chronic urticaria may need to take antihistamines regularly until their symptoms resolve. This could be ranging from a few weeks to months. Use of non-sedating antihistamines is more preferable. If the response to a standard dose of antihistamine is less, then updosing the antihistamine up to 4-fold can be given. In cases where the severity of urticaria is failing to reduce or a relapse is frequent, anti-IgE monoclonal antibodies, treatments, or immunosuppressive medications can be considered. A small subset of chronic urticaria may be caused by an underlying autoimmune disease, which can be then managed with a consultation with rheumatologist. A small subset of patients of chronic urticaria may be caused by underlying autoimmune diseases, which can be managed in proper consultation with a rheumatologist. In addition to medications, patients with chronic urticaria may be suggested proper skin care routine as to avoid easy triggering of urticaria, like using a soothing lotion or cool compresses to ease the itchiness, wearing loose, light cotton clothing, avoid scratching, choosing gentle cleansers and moisturizers for sensitive skin, avoiding exposure to common triggers. It is important to caution the patients with chronic urticaria regarding use of supplements or alternative medications, as these may trigger hives. Being a stressful condition, chronic urticaria patients should be given proper counseling, hand-holding, educational resource for better understanding of the condition, its complexity, and available treatment options. Nonetheless, these patients should also be impressed to maintain a stress-free routine, a healthy diet, and lifestyle. I hope I have been able to give you an overview of urticaria. If you find this video useful, or for more videos, do visit DermaVidya.com. As a doctor, my advice for any skin and hair related problems is do not self-medicate. Please get in touch with an expert dermatologist nearby you. Thank you.
For more such videos, visit or log into DermaVidya.com.